Good afternoon, everybody. Today is Tuesday, December 8th, and I want to be updating you on COVID-19. So in Canada, we have 42,006,742 cases in Canada. In Alberta, we have 70,301 cases, 631 deaths. British Columbia has 38,152 cases, 527 deaths. Manitoba has 19,376 cases, 420 deaths. New Brunswick has 541 cases, 7 deaths. Newfoundland and Labrador has 352 cases, 4 deaths. Nova Scotia has 1,383 cases, 65 deaths. Ontario has 13,910 cases, 3,808 deaths total. Prince Edward Island has 84 cases, 0 deaths. Quebec has 15,4,740 cases, 7,313 deaths. Saskatchewan has 10,597 cases, 66 deaths. Northwest Territory has 15 cases, 0 deaths. Nunavut has 220, 0 deaths. And Yukon has 58 cases and 1 death total. So these are the cases that we have across Canada. Now I'll be moving on talking about Alberta's numbers and how things are in our province. So Premier Jason Kenney to lead daily COVID briefing today. Brief scheduled to set to begin at 4 p.m. Mountain Time. Watch it live here. Premier Jason Kenney will update an update on Alberta pandemic response this afternoon after the province chief medical officer of health warned Monday that new restrictions will be necessary to slow escalating rates of COVID-19 across the province. Kenney Health Minister Tyler Shandro and Minister of Jobs, Economy and Innovation Doug Schweitzer are expected to attend Tuesday briefing with Chief Medical Officer of Health Dr. Dina Hinshaw. The news conference is set to begin at 4 p.m. Mountain Time. Tuesday's updates comes aim escalating cash load and growing anxiety about the healthcare system capacity to cope. During her briefing Monday, Hinshaw warned that additional restrictions will be necessary to curb the spread of COVID-19. I will be blunt, so far we are not bending the curve back down, Hinshaw told reporters Monday. We are still witnessing very high transmission of virus, which is putting enormous pressure on our hospitals, intensive care units, and healthcare workers. The province surpassed 20,000 active cases of COVID-19 on Monday and reported 16 more deaths, including 4 on the same day in the same Edmonton Care Center. That brought the death total to 631 since the pandemic began in March. Across the provinces, 609 people are being treated in the hospital for the illness on Monday, including 108 ICU beds. Alberta's daily cases counts have been over 1,000 a day since November 24th and over 1,600 a day for almost a week. Alberta has the highest rate of new infection of any province. Kenney last announced new restriction rules on November 24th. They were due to reviewed next week. Those measures included restrictions on businesses that were designed to keep them open while reducing the spread of novel coronavirus. A province-wide ban was introduced on gathering inside homes beyond those who live. Their exceptions were made for people who live alone. Hinshaw said Monday's difficult to pinpoint why the restrictions did not bend the curve, adding, "It's always a combination of rules themselves and of the people's willingness and the ability to follow them." So this is today in Edmonton's numbers, and again every day our numbers are increasing. We have to again it's very important that we protect ourselves, or there's going to be issues that are going to be coming. I will be reading the Calgary news. So everything you need to know about COVID-19 in Alberta on Tuesday, December 8th. Alberta is to receive 3,900 doses of Pfizer COVID-19 vaccine next week. So vaccines are planning to come next week, so that's a good thing. And already our federal government approved that yesterday about the COVID-19, the vaccine. Alberta will have to bring in additional restrictions if it hopes to slow the spread of COVID-19, which has now topped 20,000 active cases, says Dr. Dina Hinshaw, the province chief medical officer of health. The latest measure brought in have put the province in a better position than if those restrictions not been introduced, but aren't bending the curve enough, Hinshaw said Monday. Premier Jason Kenney will be joined by Hinshaw and members of his cabinet for an update on Tuesday at 4 p.m. on the province pandemic response. The Priorities Elimination Cabinet Committee met Monday to discuss the potential further restrictions to slow the spread of COVID-19. The province will receive a shipment of 3,900 doses of Pfizer COVID-19 vaccine next week. The vaccine is under review but has not yet been approved by Health Canada. The news comes after Prime Minister Trudeau announced Monday morning that several hundred doses of Pfizer COVID-19 vaccine will be available in Canada before the end of the year. Short primary and marked for long-term care homes, residents and the staffers working there. Military reservists are preparing for possible development in the prairies as COVID-19 rates soar. Alberta hit another grim milestone on Monday with 20,067 active cases of COVID-19. That soared from 19,484 active cases on Sunday and 18,806 on Saturday. The province reported 16 more deaths, including 6 on the same day at the Edmonton Chinatown Care Centre. As Monday, Calgary had 7,472 active cases and Edmonton had rise of 9,190 across the province. A total of 609 people were being treated in the hospital for the illness, including 108 in ICU beds. The province reported 1,735 new cases with positive rate of 8.5%. Alberta Health Services has changed its class isolation recommendations so that mask workers who were more than 2 meters from the person with COVID-19 may not have to quarantine for 14 days like they currently do, but critics say it's unrealistic and some accuse the government of changing a best practice in order to keep schools open. The first president of Alberta Health Services, who wrote the report that's helped guide Australia to aim for zero COVID-19 cases, said the country's lockdown shows the economy and the health don't need to be at odds. What you need to know today in Alberta. Alberta will receive a shipment of 3,900 doses of Pfizer COVID-19 vaccine next week. Two Albertan government officials told CBC News on Monday that the federal officials have told the province counterparts to prepare for those initial doses in the coming days. The news comes from after Prime Minister Justin Trudeau announced Monday morning that several hundred doses of Pfizer COVID-19 vaccine will be available in Canada before the end of the year. Shots and potential officials said will be earmarked for long-term care homes, residents and staffers working there. They added that the Alberta government goal is to complete the first round of immunization on a large swath of those high-risk group by the end of the holidays. The vaccine is under review but has not yet been approved by Health Canada. The Pfizer vaccine required 2 rounds of immunization, meaning that Alberta's first shipment would vaccinate just under 2,000 people. Hinshaw said Monday afternoon that one vaccine receiving site would be in Calgary and one in Edmonton. For now, eligible receptionists would have to come to those sites to be vaccinated. Hinshaw said Monday that Alberta's measures have been aimed to strike a balance between the harms of COVID-19 and the harms of additional restrictions, but that right now the balance is tipped heavily in favor of COVID-19. The exact restrictions that are needed, that's where that question lies, but I do believe we need additional restrictions in order to bring our case numbers down and protect our healthcare system. Hinshaw said her team will make recommendation to the Premier and his cabinet in the coming days. The Canadian military is preparing for possible development of troops in the Prairie provinces, potentially as early as Saturday in Alberta, to assist with the response to COVID-19 pandemic. CBC News has learned all of the Army divisions and joint task forces across the country were asked earlier this fall to check how many part-time soldiers would be available for duty so as to have 300 reserve soldiers in each area, a senior defense source said. Last week, the military expanded the call in anticipation of troops helping out with the vaccine distribution, although no numbers have yet been attached to the new round, the source said. There has been a special focus on calling up reservists in Alberta, Saskatchewan, Manitoba in cases there is a call for assistance for those provinces which now have among the worst COVID-19 infection rate in Canada. With 18% of the province schools, our COVID alert or our outbreak status, Alberta Health Services is changing its classroom isolation requirements to contact tracers will now assist school staff exposures on case-by-case basis. Previously, contact tracer said anyone who has been in a classroom with an infectious person was considered to a close contact and required to quarantine for 14 days. Now teachers or school employers who were within 2 meters of infection person for less than 15 minutes while wearing a mask and practicing a good hand hygiene may not be considered a close contact. Any students who were in class with an infection person more than 15 minutes total will still have to quarantine for 14 days. Alberta Teacher Association President said the new restrictions may be impracticable and impossible for teachers to meet, given how much people move around inside school and classroom. Furthermore, with the Alberta government contact tracers overwhelmed and unable to keep up with all school-related cases, how they will assist staff members on a case-by-case basis. The policy change has the wolf of pandemic to me, said Canadian Union of Public Employees, CUP Alberta President Royal Gill, which is we're not going to be able to keep these schools open if we abide by the best practice. So we're going to change that practice. Calgary Mayor Dancy said Monday that if Kenny's government doesn't take actions to implement new restrictions, he'll call a special meeting of the City Council himself to discuss new measures in Calgary. We are way beyond the time we're even have 24 hours to spare. Decisions have to be made today. They have to be made tomorrow, and we have to work way harder on flattening this curve, the mayor told the media on Monday. Edmonton Mayor Don Iveson warned Monday for a potential disaster unless COVID-19 cases in the city are brought under control. With more than 9,000 active cases in the Edmonton zone, Iveson called a special council meeting for Tuesday to discuss what a city to do to help to curb the spread. We are on collision course with a calamity, Iveson said. Iveson said the city will now consider what it can do on its own while the city officials continue to press the province for stronger public health orders. The numbers are likely more significant even than what is best reported, Iverson said. I think stronger measures are required. The city will consider closing or curbing non-essential activities, including businesses, Ivan said. Alberta surpassed 20,000 active cases on Monday with a positive rate of 8.5%. Premier Jason Kenney said last week the province is waiting to see what the effect the most recent measures have before announcing any new ones. Kenny's government rolled out new restrictions on November 24th for several weeks, largely prohibiting all indoor private social gatherings beyond one's immediate household and limiting outdoor gatherings to a maximum of 10 people. Following public health guidelines for COVID-19, he also sent home students in grade 7 to 12 temporarily hated team sports and group fitnesses classes, further restricted or closed some businesses, and instituted mandatory mask laws in two large cities which already had them in place under municipal bylaws. However, he came under fire in some quarters for allowing restaurant, bars, and casinos, churches, gyms, and many other businesses to stay open with restrictions, and the measures fell far short of the potential lockdown that many doctors and healthcare workers had called for. Kenney did not hint last Thursday that any possible new restrictions would be linked to the hot zones of the province, Edmonton and Calgary. Kenney has said the value would be the key metric in determining whether those restrictions would be lifted on December 18th. Kenney said he would evaluate the restrictions on December 15th and the province would need to have a value below 1.0 in order to lift the restrictions. Ideally, he said the province would have R value 0.8. Here is the regional breakdown of active cases reported on Monday. Calgary zone 7,472, up from 7,288 reported on Sunday. Edmonton zone 9,190, up from 8,963. North zone 1,147, up from 187. South zone has 654, up from 642. Central zone has 1,473, up from 1,391. Unknown has 131, up from 113. As at 8 a.m. Eastern on Tuesday, Canada COVID-19 cases count stood at 42,003,057 with 71,539 of those cases considered active. The announcement comes a day after Visor and German partner biotech confirmed to CBC News that the drug companies are prepared to ship vaccine doses to Canada with 24 hours or regulatory approval. Ontario reported on Tuesday 1,676 new cases of COVID-19 and 10 additional deaths, bringing the province's death total to 3,808. As Tuesday, the province reported 794 active COVID-19 patients in hospital with 219 in intensive care units. The update from Health Minister Christine Elliott comes a day after the province reported 1,925 new cases of COVID-19, a new daily record. Quebec on Tuesday reported 1,564 new cases of COVID-19 and 36 additional deaths, bringing the province's total death to 7,313, as Quebec deals with rising COVID-19 cases and increased pressure on its healthcare system. Premier François Legault said Tuesday his government isn't ruling out and implementing further restrictions. Hospitals increased 835, with 114 people in intensive care units, according to provincial data. As Quebec deals with rising COVID-19 cases, pressure is on the healthcare system. In Atlantic Canada, Prince Edward Island reported no new cases of COVID-19 on Tuesday, leaving the number of cases in the province at 84. Chief Public Health Officer Dr. Heather Morris announced 4 additional cases on Monday, all individuals in the 20s and 30s. Morris said at a briefing Tuesday, the enforcement of new temporary rules will focus on gatherings and warnings will be followed by fines. Newfoundland and Labrador reported 1 new case on Tuesday. Premier Andrew Furey said on Monday the province would not be rejoining the so-called Atlantic bubble for the least next month. That means all visitors in the province will be required to self-isolate for 14 days whether they're from Atlantic Canada or not. Nova Scotia reported 8 new cases of COVID-19 and New Brunswick reported 2 new cases on Monday. Across the north, Yukon reported 1 new case of COVID-19 on Tuesday, bringing the total number of cases in the province to 58, with 10 of those considered active. Nunavut health officials had not yet updated their figures on Tuesday, but on Monday, the territory reported 3 new cases of COVID-19, all the community of Avare. Holiday gathering will be outlawed in Manitoba this year as the sweeping COVID-19 restrictions will be extended into the New Year's, though officials have added a number of exemptions to the province health order. The restrictions will continue into January. Chief Provincial Public Health Officer Dr. Brent Rosen and Premier Brian Polster announced Tuesday. He made the comment as Manitoba announced 13 more deaths to 245 new cases and provincial test positive rate at 13.3%. Saskatchewan health officials reported 274 new cases of COVID-19 and 1 additional death on Monday, bringing the provincial total deaths to 60. In British Columbia, COVID-19 restrictions were extended to January 8 as transmissions and community spread of illness remain high. When the Prime Minister called on Canadian industry to retool to produce a productive equipment in the early pandemic, dozens of drastic from making a spread to hand. So doses of Canada scrambled to produce tens of thousands of liters for free at height of shortage. About a dozen in BC alone were supplying hospital governments, offices, and emergency workers all over the province. As the months wore on, some began to change to cover the cost of making the sanitizers, but many continued to donate thousands of liters to people and organizations in need, being careful not to profiteer in the time of crisis. With winter cold and influenza season approaching, Alberta Health Services will prioritize Albertans for testing who has symptoms and those groups which are at high risk for getting or the spread the virus. General testing is currently unavailable to people with no known exposures to COVID-19. Those who test positive will be asked to use the online COVID-19 contact tracing tool so that their close contact can be notified by text message. The province says Albertans who have returned to Canada from other countries must self-isolate unless your situation is critical and required to call 911. Albertans are advised to call HealthLink at 811 before visiting a physician, hospital, or other healthcare faculty. The province also operated a confidential mental health support link, and additional helpline are available for advice on handling stressful situations and ways to talk with children. There are 24-hour family violence information line, and universal 170 language and Alberta One line for available. The Canadian military is preparing for possible development of troops in the Prairie Province's potential as early as Saturday in Alberta to assist with their response to COVID-19 pandemic, CBC News has learned. All of the Army divisions and joint task forces across the country were asked earlier this fall check how many part-time soldiers would be available for duty so as to have 300 reserve soldiers in each area, a senior defense source said. There has been a special focus on calling up reservists Alberta, Saskatchewan, Manitoba in cases there is a call for assistance for those provinces which now have among the worst COVID-19 infection rates in Canada. Provincial requests for pandemic assistance for the military must be routed through the Office of Public Safety Minister. Bill Blair, a spokesperson for Blair, on Monday said he has not received a request for helping from the Alberta government, but did not respond to the follow-up question about any such request from Saskatchewan or Manitoba. Late Monday night, Blair tweeted that the minister has approved a request for military help to contain rising COVID-19 numbers in the Fond Lake First Nations in northern Saskatchewan. A spokesperson for Alberta Health Minister Tyler Shandro said the provincial government has made no request for military assistance and is unaware of any such planning. The military is calling out reservists now because it anticipates that may have the difficulty finding enough part-time soldiers to staff long-term care faculties and perform other pandemic-related missions, said the defense source who spoke on the condition of conditionally. A national defense spokesperson did not respond to any interview request. Late spring, the military mobilized 8,000 reserves as part of its coronavirus response, known as Operation. They were part of 25,000-strong task force of soldiers, sailors, and air crews who were prepared to respond to requests for help, including working at the long-term care faculties. We have been told that we need to prepare for an order to come at any moment, said a reservist who spoke on one condition. The one thing that really kind of struck myself and a lot of other troops is how insist they were about it and the timelines. It's not known whether active service members are also being trained. The Ottawa defense source said one of reservists has been signed up. They will be tested for COVID-19 and go into a 2-week quarantine to ensure they pose no infection threat. The training for the Alberta reservists including instructions on everything from how don personal protective equipment to how to interact with dying patients. Two Alberta reservists told CBC News the order to complete the training by December 12 came down suddenly in late November, and their understanding is the troops could substantially be developed in any time. It is an option that they are looking at in case things get truly bad, but there is no hard plan yet, said one of the reservists, who also spoke one condition of conditionally. The numbers of Alberta continuing care faculties with COVID-19 outbreaks of 2 or more cases has more than tripled in the past few weeks. So far, 63% of province 631 deaths have been in long-term care faculties or supportive home living sites. Alberta continues to shatter at its COVID-19 case records, recording a new high of 1,879 new cases on Saturday. On Friday, Chief Medical Officer of Health, Dr. Dina Hinshaw, said the province had reached a grim milestone as positive rate reached to 10.5%. Long-time Edmonton critical care physician Dr. Nolan said the military recognized the urgency of the situation. I think that clearly the military is looking at the statistics and numbers from Alberta, realize that within the next 2 to 4 weeks, the situation is going to be very much a crisis in Alberta and particularly in long-term care homes, he said. The military recognize something that the provincial government doesn't, or maybe they recognize it, but they are not ready to actually admit that yet. In an interview on Tuesday, opposition NDP leader Rachel Notley called the news of the military preparation as significant of the Kenny's government pandemic response. The reason that we are in this position is because of this government refusal to take responsibility action to reduce the spread and control the spread of COVID-19 throughout our community, she said. The revelations that military reservists across the province are preparing to assist with the province pandemic response comes less than a week after Kenny, in a Facebook Live video he later posted on Twitter, accused the media of touring pandemic coverage. I do regret that in so much of the COVID-19 coverage and debate there has been pretty constant a kind of drive towards, Kenny said. We need to take this very seriously, all of us, and Lord knows the government of Alberta is. At the same time, we should not allow voices of pandemic to drive people into a sense of despair. Keep calm and carry on, Kenny said, referring motivational phrase of British government during the Second World War. On Thursday, CBC News revealed that the Alberta government has been planning to fill hospitals in Edmonton and Calgary at a large university sport faculties to treat 750 COVID-19 patients. A draft plan dated November the 28th said the greatest challenge to getting the field hospitals operational would be staffing, and that further exploration of staffing options, including military, is in progress. In the spring, Canadian troops were developed to long-term care homes in Ontario and Quebec to aid faculties overturned by COVID-19 outbreak. The mission cost taxpayers about $53 million. Because we are not non-healthcare practitioners, we would be helping with supportive care, one of the reservists said last week. So feeding, moving patients, assisting patients with daily activities. The reservist added that one thing that really stood out to me was basically how they implemented that. We're going to be dealing with bodies and people at the end of life. A slide titled Carrie said, caring for the body and decreased in something that we may experience during its occasional to pay our last respect to the person. So these are the cases that we have in Alberta, and the numbers are really high. So I encourage everybody to do what they can at the end of the day by protecting their health, by following health guidelines and following health rules. Vaccines are coming the way. I just read a whole article about vaccine. Vaccine is coming on the way, so it's very important that you make sure that you protect your health and everything, because our numbers are really high. Like I said, the vaccine is not going to do everything. It's not going to protect everybody. It's not going to make the numbers slowly go down. They will go down slowly, but this will take time with the vaccine, right? The good news, the vaccine is coming next week. I think maybe by mail next week, hopefully maybe by Tuesday or Wednesday or sometime next week, we will get the vaccine and it will be ready. But at the end of the day, we have to do also our part by making sure that we protect ourselves and making sure that we do what we can at the end of the day, because the vaccine at the end of the day is not going to do its part if we do not do our part at the end of the day, and making sure that we have to do our job before the vaccine comes next week. So it's very important that things are not over yet, so that means we shouldn't go out for no reason thing. We shouldn't do anything, do any kind of exercise or do anything if we cannot do it. We have to watch out how we do things. We have to protect our health, protect our loved ones. That's what's really important when it comes to this COVID-19, is we have to do what we can and making sure that we protect ourselves and we do what we can at the end of the day. Because these numbers are no joke. When I read these numbers of Alberta and I read the numbers of Canada, these numbers are not joke. They are really serious numbers. So we have to do what we can, and we have to do our part as much as we can. like how we care about other people. We have to show how much we care about ourselves. That's what's really important about this whole COVID-19, right? We have to learn something from this experience of history, right? So it's very important that we have to follow our rules and follow the health guidelines and do what we can. And hopefully by the time we reach the New Year's, or hopefully by late February, hopefully we won't have numbers. We should be way better by that time, I'm hoping. And life will go back to normal because we have now vaccine coming. So that is a good sign. That means we are getting close to going back to life normal. But we have to do what we can at the end of the day and making sure that we have to protect ourselves as much as we can, because that's what's really important and that's what I expect everybody to do at the end of the day, right? And like I said, next Friday I will be announcing um, when the school will be opening, because there's still I didn't make a real decision yet when will actual open, but hopefully by next Friday I'm hoping is to have real decision on when to actually open the school. So you guys will have that information coming to you the following Friday, not this Friday coming, but the Friday after that you're gonna have that information. So just for you to know that that's something that will be coming next week. Also on Friday, this Friday coming, you're gonna have a quiz coming for lesson 1 to lesson 8, and you're gonna have to study that and make the time to study and making sure that you understand so you're prepared this Friday. And then next Tuesday we're gonna have a unit exam for from lesson 1 to lesson 14, and you guys will have the whole weekend to study from lesson 1 to lesson 14 and making sure that you prepare for that unit exam on Tuesday. Exactly, and that will be only on unit 1. It will not be on unit 2. So just that's what it is. And today I'm going to be going over with the first lesson. Is there any questions about has to do with COVID-19 or has to do with the vaccine that's going to be rolling out next week? And the military already, they're going to be helping in Alberta and they're going to be helping in Saskatchewan. So we are going to get help from Alberta and Saskatchewan and maybe Manitoba, and they're going to be divided in each provinces when it comes to the vaccine. And when it comes to the help, there will be each provinces that there will be division of militaries from each province that they're going to be divided, and they're going to be distributing the vaccine and making sure, right? They're going to start from Quebec and go all the way till the prairies, and from the prairies all the way to go to the territories. So this is where the vaccine is gonna come. So I will say by January we are gonna be getting, right? The two vaccines we're getting is gonna be Pfizer and Moderna. We're not gonna be getting Oxford. Oxford is out, but Pfizer is gonna be the #1 vaccine coming to Canada first, and then it will be Moderna will be coming afterwards. So those are the two vaccines that will be distributed across the country. America also is get it next week, so it's not just Canada's coming, but Canada is getting it next week. So we have it coming. I don't know what day when next week will come. The government will approve it on Wednesday after tomorrow. Tomorrow the government will approve it, and it's supposed to come hopefully maybe by middle next week, maybe by end of next week, maybe just right before the winter break. I don't know the information. I'm not the government here to know when actually it will be, but I know that the government will approve it on Wednesday. So Wednesday there will be approved vaccine that will be distributed, and it will come either hopefully by Monday or either by Tuesday or sometime next week it will come. There's not enough detail for me to know when actually will come next week, but the only thing we know is it's gonna come next week is when the vaccine will be coming. So we have to wait that long and see what the vaccine will do and what will happen, because like I said, it will not come in Alberta hopefully by end of December or maybe even beginning of January. I'm thinking it might come by that time, because first it has to go to Quebec, because Quebec has higher than all the other provinces. Then it will come to Alberta, then Ontario, and from Ontario then we are next. I think we are next, and then it will be I think BC after that, and then Saskatchewan and Manitoba, and then it will be the territories that will be the last. So that's how the vaccine it will be divided, and that's how it's going to be divided in each provinces in each territory. That's how the vaccine will be, and it will be distributed in every way. But that's the information I know. It's going to be going from one place to another place, and it will take. So we're not going to get it right away in the December. I think the first province will get it in the December will be Quebec. And then the second province, I think it will get it. It will be in Ontario, and it will be going so on like that. So we will see how that happens, what the plan will be, and all it depends at the end of the day how things are gonna be handled at the end of the day after everybody gets the COVID, right? So that's what it is. Is there any questions that has to do with the COVID-19 or has to do with anything that I just talked about? Because I talked about the COVID-19, I talked about how these things are going to be distributed in every way, because it's very important everybody knows that these things are not just going to be coming like this and leaving like this. They're going to be distributed. So this takes time for it just to go to each provinces and each territory, right? To territories, they might even maybe get it by end of January or something. Maybe by end of January, February. I'm thinking the whole Canada should have it by then. But and then I don't know. Like I said, I have to make the decision next week if the schools are going to be open or not, because we will see with the vaccine next week how things are going to go. And I think Quebec and Ontario might get it next week, but we're going to have to wait until maybe the first week of the New Year's or maybe the second week of January. So that's by then we might get it by that time, right? So we just have to be patient now until it comes, because vaccine doesn't come right away. And before it comes, until it comes, we have to still protect our health. We have still responsibility to protect ourselves and making sure we make sure that we don't give people diseases, and making sure we do what we can at the end of the day. That's what's really important, and that's what really everybody needs to understand, because if we don't follow health guidelines and numbers are really bad in Alberta, it's the worst death rate, the worst cases that we have across the province. We have to do what we can at the end of the day, right? The vaccine's gonna come, but the more numbers are going to come, the more it's going to take time for these numbers to go down. So we have to do our part too. The vaccine will do its part by coming, and we're going to have we're going to have vaccine from the Moderna and from the visor. But we have to do what we can at the end of the day also by making sure we stay home. If we have COVID, we make sure we go get tested, right? There's contact tracing that you can go do to make sure that you get tested every weekly. And all these things, all these health rules, don't go and give it to people, don't do gatherings, don't do anything. That's what I want to say. Like I said, we're supposed to even be a lockdown. Going outside, you have to understand, going outside is like a danger. If you're in your home or you're anywhere else, it's safer than going outside and getting exposed with this COVID-19 and getting sick. And really, people should know better, right? And that's why we have high numbers, because our government is already enough. Our government is not taking any responsibility to protect Albertans by not doing anything. But at the end of the day, people should have their own opinion also. When you see something wrong, you make sure that you do not do it. And if you see somebody doing something wrong, like our government did not bother doing any lockdown when it came to this COVID. How many beds already our provincial government had to lay out last week? And if you have that many beds, you might as well lock down the whole province and care about people's safety, right? So our numbers are really high because of that kind of stuff. And then on top of it, there's people that don't want to listen, there's people that don't want to wear a mask, and there's people that still want to do parties, and there's all these people. That's why we have these kind of numbers, and we have 1,000, or now we're 19,000, so we have 20,000 yesterday, we had 19,000 other day, today who knows what we have. Today actually we have 78,000, so these numbers are really increasing. Soon we're going to be in the 10,000s, and then we're going to be going higher and higher, maybe 100,000s. This is where this is heading, right? We might not reach 100,000 because the vaccine is coming soon. Now I don't think that will happen, but if we don't want the numbers to keep going until the vaccine comes, and that, like I said, that either will come beginning of January, because it will take time. It's not just something's gonna come right away for them to ship. For it to come to Canada, it's gonna have to come to Quebec first. All of Quebec province the whole Quebec province has to get it first. Then Ontario has to get it. Then we're gonna be getting it by the third. So I'm saying it's already gonna come end of December, and we are next week already. The vaccine will come. I don't think it will be distributed next week, but I think it will come next week to Canada. I think slowly will be distributed. Everybody has to take it, and for it to come in Alberta, it will take time. It's not going to be fast, right? And they're going to start with the provinces that have high rate. So the vaccine, it will go to high rate provinces. High rate provinces, I mean the provinces that have high cases of numbers of deaths, have high cases of number of cases. Those are the vaccine is where it's going to be heading to. Is heading to those provinces that have high cases and have high death toll. This is where these vaccines are heading to. Also, the vaccine will be for the people who are old, the people who are in the 70s, 80s, those people, because those are the more people that are dying now today, especially those you can hear every day 70-year-old man died because of COVID, or 60-year-old woman died for a COVID, and we hear that every single day. So this COVID vaccine, it will go for the people who are old and vulnerable, so people who can't move around, people who can't walk around, the long-term care people, the people in the hospital and the people in the beds, those are the vaccines gonna go first to. Then it will be distributed to everybody else, because there's steps to this. There's not everybody's gonna be healed at once. There's steps when this comes to this vaccine. It's not gonna be right away coming to Alberta. That's not something will happen. It's not gonna be right away for the people who are like teenagers or people who are just in the 40s or 30s. No, there's steps to this. It will go first to the people who are old, the healthcare workers, the people who work in the hospital, those are gonna have to get it, the doctors, all these people gonna have to get the vaccine first before everybody else gets the vaccine, because there's a process here for the vaccine. There's a process. It's not just one person will get the vaccine and that's it. There's a process with this vaccine, and it has to go first to the people who are working, the doctors and anybody who's working in the healthcare have to get the vaccine first. You're forced to take the vaccine even if you don't want to, because your healthcare, you are dealing with the COVID, you're dealing with all these stuff, so you need that vaccine. So it's emergency, has to go to these people first. After it goes to these people, then it has to go to the old people, the people who are in the 70s, the people who are in the long-term care beds and in the faculties and in the hospitals. Those are the people who are going to be going first. Then after that, everybody else, the people in the 40s, people in the 30s, anybody else can take it after that. But this steps to this, and then at the end of the day, it will go also, like I said, for it to come in Alberta, it will be maybe beginning of January. We shouldn't be saying, oh, it's gonna come end of January just because our federal government announced next week it will come. No, it announced that next week it will come to Canada, but it will start with the provinces that have high rate of COVID. And the provinces that have high rate of COVID, we know Quebec and Ontario and those huge provinces, they're gonna go from the east to west. It's gonna start from Quebec, it's gonna go to Ontario, and then it will be going to Alberta, and then it's gonna go to BC, and then it'll go to Manitoba, because Manitoba is higher than Saskatchewan, and then it will be going to the territories, Nova Scotia, New Brunswick, all these territory, and Atlantic Canada. All these territories and provinces are gonna, maybe I'm hoping maybe by end of February maybe, or by then everybody, the whole country should be okay by that time and everybody should be fine. But that takes time, right? That's even February, if even lucky, if everybody even gets healed by then. But for it to come here, like I said, it will be in January for sure. But right, it can be middle of January too, but I'm thinking by beginning of January, in the New Year's, we might get the vaccine by that time, because the military, they are divided across the country. They have to give it for each province. That all is gonna take time. For it to come here, it takes a couple of days to travel, and all that. Think about it. So we don't know, but we have to. I think we have to be ready, and we can do this, and we will go through this, and we're gonna go back to normal life. Things are gonna be okay. But what's really important is people need to protect themselves until the vaccine comes. Please, you don't need to go down. You don't need to go outside so much. You don't need to travel. You don't need to do none of these things, because all these things are not necessary now. Just protect yourself. Everybody's excited for vaccine coming. Yeah, that's good news. That means we're gonna go back to normal life. I mean, I'm gonna be able to open the school again. Everything's gonna go back to normal. But for that to happen, we have to do what we can. Everybody, if they don't do their part, how are we gonna go through this all together with us? One person cannot change the whole thing. You need a whole country, a whole nation can do this together. The whole province can do this together for it to leave, for it So we do, because we have to know health is what makes us ability to do everything. Health is what makes us live today. Health is what makes us do things today. Health is what makes us go to school today. Health is what makes us work today. Health is what makes us do everything we can do today. So we have to know how important health is, because there's people out there that from the time of the pandemic, there's a lot of people that did not bother taking their health seriously in any way. And that should not be a joke. This should be something very seriously, and people need to wake up from it and not joke around with it. So all I'm saying now, our numbers are really high in Alberta. People need to really understand that it's very important to make sure that you protect your health as much as you can. And what I'm saying that I'm being the fact here. What you need to do is making sure that please don't need to travel, you don't need to go grocery shopping, you don't need to do anything until the vaccine comes. Even if the vaccine comes, it takes time to kick in to the person. It takes time the numbers to come down. All this will take time. For it to come to Alberta, it will take time. For young people to get it, it will take time. And there's levels. Like I said, there's the doctors, there's the nurses, there's all the people that are working in the healthcare. They're gonna have to get the vaccine first, and they're forced to because they work in the healthcare. They need to take that vaccine. You can't say I don't want, even if I work in healthcare and I want to take the vaccine, I'm forced. It's not an argument or negotiation. If I don't take the vaccine, they're gonna kick me out. Even if you don't have the COVID, you still gonna have to take the vaccine because this is your protective equipment. That's the whole point of the vaccine came here, right? The government didn't pay this much money, then at the end we wouldn't even bother taking it, right? So if you're a healthcare worker, you're gonna be forced, whether you like it or not, you're going to have to take the vaccine. And old people who are in the 70s, people who are in the 80s, people who are in the 90s, all these people, they're gonna have to take it too, because we can hear majority of the people who die from COVID are the old people, and the people who are vulnerable, the people who are in the long-term care homes, those are the people that are getting the COVID cases, and they're dying. Lots people lost their family member, either as a mom or a dad or somebody, and they're all people. So I'm just saying, all these people, they're gonna have to take those vaccines too, because their health is more at risk than our health. When you become old, your body starts aging, cannot fight diseases, cannot fight anything. So at the end of the day, they need that vaccine so they can live, they can be protected. This is an emergency for the old people too. This is a process. Then after, when it goes to the old people and it goes after the healthcare workers and the people working in hospitals, then after that it will go to anybody who else who wants the vaccine will take it. But this is a process, so we shouldn't. That's why I'm saying people need to hang in there until the vaccine comes, because we're thinking it's very close we're gonna get it. We don't know. We might have to wait till mid January, and that's far away. That's like maybe another 4 weeks we have to wait for this vaccine. Numbers can be higher than that. So what we need to do is, right, even the government should do the right thing and lock down in those 4 weeks, because really at the end of the day, our health really matters at the end of the day. It doesn't matter. 4 weeks is a long time. 4 weeks is like another month we have to wait. So we don't know how long this vaccine will come to Alberta and all that stuff. So we need to wait. We're not in Ontario or Quebec and we can say we're the first province to get it. We are the third or the fourth province, and that takes time because each province has to make sure all their citizens have it. So that's again, that's not easy, right? So we have to be patient and we have to be waiting for this, and it will come. But we're not patient, we don't wait, it's a big problem. So please make sure that you protect your health, you protect your loved ones. That's what really important, and really I want everybody to do that, to make sure that your health is really important. Please don't go out if you don't need to. When things get safe and the pandemic leaves, then we can go and do the life that we want. We can go back the way we want. We can go back and enjoy life the way it is. We can go back to normal life. But until then, we need to stick on there and making sure that we protect our health, making sure that we stay the way we are. That's what we need to do, because at the end of the day, this is the kind of thing, right? This is the kind of thing makes numbers go high. And the higher the numbers are, the higher it's going to take time for these numbers to go, right? Like somebody has flu for a couple of days, maybe for 5, 6 days, and whatever, and that flu keeps going on and on. Your body, even if you take one medicine, one medication, is gonna take time. If you take 2, 3 medications, it's like that. For this, people have to maybe take more than 1, 2 shots of the vaccine for that numbers to go down. But until then, we need to do things. But there's people that are excited now and they're saying we can go outside and we can just do whatever we want because there's vaccine gonna come. No. And especially if you're in your 30s or you're in your 40s or even you're younger than that, you're gonna have to wait until the healthcare workers get it, until the old people get it. This process here when it comes to the vaccine. And you have to wait for it to come to Alberta because it's not gonna come in Alberta right away. We have to be patient and wait because we have to understand we're the third province or the fourth province. Yes, our numbers are really high. That's true. Makes sense, right? Numbers are really high. We're supposed to get it the first if we're higher than the whole province, but it doesn't work that way. What works is the provinces that have um, high rate of the provinces that have high population, those are the provinces get it first. And then the provinces that have these levels to all this to this whole vaccine. We have to understand, yes, Ontario has high numbers, but again, Ontario is a little bit higher numbers than us. When it comes to the numbers, comparing our numbers to Ontario numbers, our numbers are way little bit lesser than Alberta. But that does not mean our numbers are good or they are acceptable. No, they are not, because people are not protecting their health. They are not following the health rules. They're not doing what they can. So you can't say that our numbers are way better or is this, right? If you see Saskatchewan or even the territories, their numbers are, we can say they're better than us because their numbers are not in the thousands. Once you reach the level of thousands, you're not in the safer. You're not safe anymore. You're in the danger zone. And like I said, Manitoba, their numbers is like 100 and something cases, and already the premier is yelling at the citizens and they're upset. And look at us, we have a premier here that we have at 20,000 cases a day, and he's not doing anything about it. There's hospitals, people are dying every single day because of him. It's a way record, and he damaged himself now. He had the opportunity during the COVID-19 to make sure that he protects Albertans, to make sure that he protects their health, and he did not do that. Instead of he's doing that, now it's too late because we have vaccine coming now in a week, and he didn't do anything for the COVID-19. So at the end of the day, it doesn't matter now. He can't fix that mistake anymore. He can't do nothing about it, right? Because who brought the vaccine is the federal government. He's not even the one who brought it, and he's not the one even protect the citizens. All his job's supposed to done, the premier, is to make sure to protect Albertans, and he failed to do that for the whole pandemic. He cut healthcare workers. He did not help the citizens of Alberta. He made them suffer. People lost jobs because of him. All these crises. There's no one success of this premier that accomplished during the whole pandemic. At least the federal government did a lot for the whole pandemic. They gave money. That's what a government is. Because when you're a government, it's your responsibility to make sure that you protect the citizens and making sure the citizens are in good health. It's not your businesses are more important than people dying every day. Because he's thinking his businesses, he runs it every day. It's not like even our economy is that great, or whether people really, when they care with their businesses, is when you have a good economy. But if you don't even have a good economy, and our economy is really bad now because of this pandemic, this is not the time to go and focus on your businesses more than focusing on people's health and people's stake. And he's thinking his businesses are more important than people dying. People are dying 300 and something that die a day every day. Maybe even slowly we're gonna even be having thousands a day die, and he's not doing anything about it. So that tells you that there's people that are rich, and they, instead of using their money for good, they use it for bad stuff. And that's what the premier is doing. He's using his money more to build his businesses, to build his pipeline. But when coming to helping the citizens, no, that's not my job. That's not my goal to do. And that's the attitude that the premier is giving to the Albertans. This is where you can see the government has a lack of action and does not have any responsibility when it comes to helping Albertans at the end of the day, because it just doesn't care. It doesn't see is that important. People's health, it doesn't matter. People's health is like, who cares at the end of the day? And that's what our premier is doing at the end of the day. is not taking nothing seriously. This health is taking it as a joke. Because if this premier took it seriously, everyone had cut jobs. We will have good jobs now, and at the end of the day, at least lock down the whole province. That's all people asked him to do, and he couldn't even simply just lock down the whole Alberta, the whole time pandemic. Now it's too late to lock the whole province because we have vaccine coming next week. That's it. Yes, good, and he's so proud today. I don't know what he's gonna say. He's so proud the vaccine is gonna come next week, and he's acting like this is an accomplishment. What accomplishment did this premier did? What accomplishment did the UCP government did? 4 years they failed, especially the time of pandemic. People are not gonna forget if you were corrupted the time of pandemic and not giving people and not helping people during the time of pandemic. People are not gonna forget that. People are not gonna choose you in the next election. And he lost that the next election. He's not gonna get that chance once this pandemic is over. And he didn't do anything the whole time of the pandemic. Even if he fixes it, even if he tries to fix his mistakes next year or the year before, he has 2 years left before the election. He's not going to be able to fix that because the pandemic is the real test. This is where you can show the citizens how much you care about them. And he failed to show that during the time of pandemic. So he's not going to get that chance again because he failed. He just proved it to the people that I don't care about you. I care more about my business rather than caring about your health. That's the message that he's giving to Albertans and to everybody. It's not just Albertans, but the whole country knows about the truth and the whole country knows about the facts and the evidence about it. So it's not something even he can deny it, right? So that's how our premier is. That's how the vaccines are going to be distributed across the provinces and territories. So we need to know that our health is at risk and everybody needs to do what they can as much as they can at the end of the day by protecting their health, by protecting their loved ones. That's what's really important because like I said, this vaccine, it will take at least a couple of days for it to come. It's not just gonna come like this and leave like this. This takes time and we need to be patient. That's what we need. And the problem is we don't have patience. That's why the numbers are increasing every day in Alberta. Because if we have patience, our numbers will not be high. We have a premier that tells us do whatever you want, and I'm not going to lock down, but that's not the right thing to do. Just because you have somebody that giving you wrong directions, a wrong order, that does not mean you need to follow. This is a government. We're supposed to follow the government, but we should not follow the government if the government itself doesn't know the right from the wrong. And that's what Jason Kenney's government is. He doesn't know the right and from the wrong, what he needs to do. And for that kind of reason, in that point, you don't need to follow the government because the government is leading you to the wrong direction. That's what the government is doing. It's not leading you to the right direction. Is not following the health rules. Health rules is very important. If Jason Kenney is saying he's following the health rules, then the health rules also says that you need to do lockdown when the numbers are high, and he's not doing that. How come other provinces did that and they took it way more seriously? And his government, the whole time of the pandemic, from the time it started from March until now, he did not take one thing seriously at the end of the day. It is upsetting when you see this government, there's no one accomplishment that you can see they did. Every other government you can see they accomplished something, they did something positive, they did something, but this government, there's nothing accomplished. The whole at least 2 years now he was ruling, there's nothing that you can see this government did. Even the pipeline that he wanted to build, now he can't build it because we have a president that is in the US and he's not going to allow it to be built. And there's nothing at the end of the day this government accomplished. So he failed miserably. He had the opportunity as a premier, he lost that. Now, when it comes to the next election, he's not going to be chosen again because he just didn't just disappoint Albertans, but he disappointed the rest of the candidate too. Because people, when they see how bad you are, it doesn't matter any job you get in the future, even if you're not the premier, people are not gonna even choose you or even accept you because they think you're just always gonna be terrible at your job. And that's what this premier did to himself. Nobody told him to go and not do lockdown. And he's saying, oh, in March I'm supposed to not do lockdown. That's what he just said 2-3 weeks ago. And the same premier talking, saying that I shouldn't have done lockdown in March, or I shouldn't have done lockdown in April. If we do not do lockdown in March, I'm pretty sure our numbers would be in a million cases a day by today if he did not do that lockdown in March. That would have been way worse. Because just because he didn't do lockdown March now, we're in the thousands. But imagine if he did not do the lockdown from the beginning. Then our numbers would have been way more higher, it would have been way more crazier. That's what the fact is. So at the end of the day, it doesn't matter, but that's what this premier did to himself, and that's what it is at the end of the day, right? Anyways, it's very important. I didn't even go through the lesson, but do lesson 3 and lesson 4 today for homework is due today at 4:30 p.m. Also, like I said, next Friday I will be updating um, on new restrictions, and also I will be updating if the school will be opening on February 20th, 2021 or September 2021. And I did not make the decision yet, but still something I'm thinking about, and we will see how things are going to be by that time. But until then, make sure that you protect your health, make sure that you do what you can, and you protect your loved ones, because that's what's really important in the day. I hope everybody follows the health rules, follows the health guidelines, because that's what's really important. And we are getting really close now to the vaccine, but we need to do our part and hang on there before the vaccine comes, right? I hope everybody have a great day and see you on Wednesday.